Assalamualaikum, hi. My name is Nur Fitrina Hamda binti Abdul Latif. Today, I would like to share with you the effect of overdose paracetamol intake. Do you ever feel headache or fever and you always consuming Panadol to relieve the pain? Do you know what is the effect if you overdosing paracetamol? Let's talk about this.
Before we discuss in depth our topic, first we should know what is Panadol. According to medical dictionary, the name of Panadol actually is acetaminophen. Its pharmacologic class is synthetic non-opioid p-aminophenol derivative, and the therapeutic class is analgesic. The function Panadol is to mild to moderate pain caused by muscle ache, back pain, headache, menstrual cramp, common cold, or fever. It is particularly safe in standard dose. In normal dose, acetaminophen does not hurt the surface in the stomach or problem with blood clots, kidney, or fatty arterial duct. A common practice among university students are frequently used drug in self-prescribing situations, according to SM Abe V. Amilo. Did you know that, according from International Journal of Scientific and Research Publications, 90% of university students consume Panadol to release their pain. This research paper showed that the study was undertaken to determine the knowledge and perception of undergraduate students at University of Pennsylvania about the paracetamol usage by self-medication practice. The data collected from the 273 respondents by courses. This figure 1 showed that usage of paracetamol by self-prescribing. According to figure 1, more than 3/4 of the students had taken paracetamol without a doctor's prescription. Only few students had taken paracetamol with a doctor prescription. Practice reason is, in minor percentage, were to avoid costs and to avoid wasting time. Non-prescription medication taking behavior might lead to problems of misuse. This is according to C.M. Akolela. And according to R.J. Giberson, paracetamol is the commonest agent employed in self-poisoning. This will lead to overdose of paracetamol. When taken in large quantities, it becomes toxic and lead to liver failure and potentially fatal. Based on Dr. Haley Williamson, author of Health Info articles, over 150 people die each year as a result of a paracetamol overdose. Toxic dose is estimated to be about 10 grams for an adult or 20 pills. To know how paracetamol overdose works, you have to understand how it's broken down in the body. Paracetamol is metabolized in the liver into 3 different products at different amounts. It's converted into paraglucoronic at 55%, paracetamol sulfate at 30%, and paraglutathione at 15%. All 3 products are non-toxic, but there is a catch when you take too much paracetamol. Paracetamol glutathione is become very crucial part of the question. Before it's made into paraglutathione, it's made into a precursor called N-acetylbiquinone or more simply NAPQ. NAPQ is extremely toxic to the liver and cause severe damage in the large quantity. Luckily, under normal condition, the precursor is quickly converted into the non-toxic paracetamol glutathione. It's when someone overdose that its paths become unbalanced. In an overdose, the first 2 pathways become overmet and can't keep up with the incoming paracetamol. This excess supply is sorted to the 3 pathways. Normally, this pathway produce at least amount of metabolite just 15%, but now it's saturated since there's more paracetamol in the 3rd pathway. More toxic NAPQ is being produced. This massive spike in NAPQ causes parapoisoning. In order for the NAPQ to be converted into non-toxic paracetamol glutathione, a glutathione group has to be bound to it. One small problem, the supply of glutathione in the liver is quickly depleted. As this path is not normally used to his extent, when glutathione storage run out, toxic NAPQ builds in the liver causing necrosis. Extensive tissue damage in the liver leads to liver failure, and once you have hit liver failure, you have done for it. There's 2 possible routes. You will end at the first systemic necrosis, when your liver become necrotic. Nearby organ also become necrotic and begin to fail as well. Eventually, the patient succumbs to systemic organ failure through necrosis. Second route is actually heart failure. When the liver dies, circulation in the organ slows down until it eventually stops from clotting on the blood vessel, with blood flow being unable to pass through the liver. Blood backs up into the hepatic portal vein all the way up into the inferior vena cava. Blood backs out into the heart and fills up the right ventricle, extending the heart muscle with so much backup of pressure that the ventricle can't pump the blood out. The patient then succumbs to right side heart failure. Here are some tips and recommendations. First, you can take the correct dose of Panadol. For adult is 500 mg every 4 to 6 hours or 1 gram every 4 to 6 hours when needed. The total daily dose should not exceed 4 grams or about 8 pills. Second, you can use paracetamol dose calculator to know the correct dose Panadol, just suitable for people aged 1 month to 18 years old. This is made and approved by My Health Navigator of New Zealand. Third, take Panadol with doctor prescription and do not get used to taking self-prescribing Panadol. Fourth, if you feel you have overdose when liver damage is not noticeable as an acute pain in the right upper quadrant, you must go to the hospital, seek medical attention. NAPQI toxicity takes effect in the liver sometimes as late as 24 hours. Patient will be given anacetylcysteine or NAC, which is supplied to the cholesterol, so the liver can convert NAPQI to the non-toxic paracetamol glutathione. Here's some case studies to prove this. In the Pan Africa Journal of Medicine, there was a case where a 24-year-old female took 50 grams of paracetamol more than 3 times the fetal dosage. The women were given NAC for 3 days and was later discharged with no side effect of liver damage. This is also approved by emergency medicine journals.
All in all, you have to take the right dose of paracetamol. If not, you are overdosing paracetamol that can cause serious effect. Even though there's health-specific treatment, you don't have to do that. You don't have to self-harm. Please don't do that. Please love yourself, because no amount of love from others is sufficient to feel the yearning that your soul requires from you. Please love yourself and remember, prevention is better than cure. Thank you for lending your ears and eyes. See you again. Bye bye. Assalamualaikum.